Today, we will talk about one of the most common and unpleasant problems faced by older people: headaches. It would seem that there is nothing to discuss here. Many of us, as well as our parents and grandparents, experience headaches from time to time. Some endure it patiently, others rush to take a pill, and some don't even think it's worth seeing a doctor. But in fact, headaches in older people are a much more complex and important issue than it seems at first glance. In this video, I will try to explain why older people have headaches more often, how these headaches differ from headaches in young people, what diseases may be hidden behind this symptom, and most importantly, what are some safe, effective, and sometimes very simple ways to alleviate your condition or even get rid of the pain altogether. Get ready, there will be a lot of details, practical advice, and important warnings ahead so that you don't harm yourself or your loved ones. Part 1. Why do older people have headaches more often? Let's start from the beginning with what happens to the body as we age. Age-related changes in blood vessels and blood circulation. Over the years, blood vessels become less elastic. Cholesterol is deposited in the walls of blood vessels, forming plaques. This leads to a narrowing of the lumen of blood vessels, slowing of blood flow, and increased pressure. Changes in brain chemistry. The balance of neurotransmitters is disrupted. The production of certain substances that regulate blood vessel tone and sensitivity to pain decreases. Decreased mobility. Many older people move less and stay at home. Sitting for long periods of time without moving causes neck and shoulder muscle tension and impairs blood flow to the head. Medications. Older people often take several medications for blood pressure, heart, joints. Some of these medications can cause headaches as a side effect. Psycho-emotional causes: anxiety, loneliness, fears, worries. Depression in older people can be masked by headaches and fatigue. Dehydration. Older people drink less water, they are afraid of edema, and often do not feel thirsty. Even mild dehydration increases blood viscosity and can cause pain. All these factors do not act separately, but overlap each other, which is why headaches in older people are often more complex than in younger people. To Part 2. What types of headaches do older people experience? Let's take a closer look. 1. Tension headache. Dull, squeezing, like a hoop around the head. Can last for hours or even days. Often appears in the evening after stress, fatigue, or long hours of work. 2. Hypertensive headache, usually in the back of the head or neck area. Maybe throbbing or bursting, often accompanied by ringing in the ears, flashing flies, weakness. 3. Symptomatic headache, may be associated with serious diseases, tumors, stroke, inflammation of blood vessels. Such pain is unusual in nature, sudden and rapidly intensifying. 4. Side effects from medication. Some people experience pain after taking nitrates, certain blood pressure medications, or hormones. 5. Secondary pain from spinal disorders. For example, cervical osteochondrosis. The pain intensifies when turning the head and may radiate to the shoulder or arm. To Part 3. When is a headache dangerous? There are so-called warning signs that require immediate attention. The most severe pain you have ever experienced, which came on suddenly. Pain, plus a weakness or numbness in the arms or legs. Speech impairment. Pain after a head injury or fall. Gradual increase in pain over weeks. Pain accompanied by vomiting, visual impairment, or altered consciousness. Fever, rash, neck muscle stiffness. If your relative or you yourself have these symptoms, do not delay in calling an ambulance. Part 4. Examination and diagnosis. To understand the cause of the headache, the doctor may prescribe measurement of blood pressure and pulse, blood tests for inflammation, cholesterol, sugar, electrocardiogram, ultrasound of the neck vessels, MRI or CT scan of the brain, sometimes a consultation with a neurologist, cardiologist, or psychiatrist. Don't be afraid of the examination. It often helps to find the cause and prevent dangerous complications. Part 5. What really helps? Methods in detail. Now for the most important part, let's take a detailed look at what you can and should do to reduce headaches. 1. Blood pressure control. Measure your blood pressure in the morning and evening, and additionally when you feel unwell. Record the readings in a diary. Do not change the dose of medication without consulting a doctor. Sometimes the cause of a headache is too low blood pressure due to an overdose. 2. Drinking regime. Even if you don't feel like drinking, keep a glass of water nearby. It is best to drink small amounts throughout the day. Tea and coffee count, but they are not a complete substitute for water. Soups and fruits also help replenish fluids. 3. Sleep and routine. Go to bed and wake up at the same time every day. Sleep in a well-ventilated room. Try not to watch the news or look at your phone for an hour before bed. If you have trouble sleeping at night, talk to your doctor about mild remedies. Herbs, melatonin. 4. Stress reduction. Breathing exercises. Inhale slowly for a count of 4. Exhale for a count of 6. Light evening meditation. Communicate with loved ones. Take a walk in the park. Keep a mood diary. 5. Physical activity. Walk for 30 to 40 minutes a day. Light exercise in the morning. Turn your head, raise and lower your shoulders. The main thing is regularity, not intensity. If you have joint problems, you can exercise while sitting. 6. Nutrition. Less salt, especially if you have high blood pressure. More vegetables, fish, porridge, nuts. Limit strong coffee, chocolate, and fatty foods. Don't skip breakfast. Hunger headaches are a common problem. 7. Compresses. A warm compress or heating pad on the back of the head if the pain is caused by tension. A cold compress or ice pack wrapped in a cloth on the forehead or temples for throbbing pain. 8. Massage and self-massage. Massage your temples, forehead, and back of the head with light circular movements. Lightly stroke from the neck upwards. You can use a massager or just your hands. Do not make any sudden movements. 9. Medicines. For older people, paracetamol or ibuprofen in small doses is preferable. Do not take more than 2-3 times a week to avoid withdrawal headaches. Be sure to check for contraindications. 10. Other methods. Acupuncture, as prescribed by a doctor. Therapeutic exercise. Physiotherapy, magnet, laser, electrophoresis. Sometimes mild sedative herbs, motherwort, valerian. Part 6. Psychology and mood. It is very important to understand that headaches are often worse when we think about them all the time. Try not to focus on the pain. Take short breaks for pleasure. Read books, do crafts, go for walks. Don't be afraid to ask your loved ones for help. Communication reduces anxiety and decreases the frequency of pain. Part 7. Personal action plan. Everyone should make their own plan. When and how to measure blood pressure. What kind of exercise to do and for how long. When to go to bed and how much water to drink. A list of safe remedies agreed upon with your doctor. Such a plan helps you feel in control of the situation and reduces stress. Part 8. Mistakes to avoid: enduring pain for weeks, in increasing or decreasing medication doses on your own, refusing to go for walks because of fear of pain, taking painkillers without control, excluding everything from your diet without medical advice. Part 9. Brief summary. Headaches in older age are not normal, but a symptom. The cause is often related to blood pressure, muscle tension, stress, or dehydration. Do not endure the pain or assume it will go away on its own. Monitor your sleep, diet, and activity levels. Work together with your doctor. Thank you for watching this video to the end. If you found it useful, please like it and subscribe to the channel. Write in the comments. What helps you? Do you have your own secrets for dealing with headaches? See you in the next videos. Stay healthy and take care of yourself.